Hi everyone, I'm Tiziano Testori and I would like to share with my staff phase 2, meaning the reopening of the office after the COVID pandemic. In a series of tutorials, the first one is how we welcome the patient, how we bring him to the OR, how we prepare the patient for surgery and dismiss him.
We welcome our patients right at the door, and one of our nurses takes their temperature. If the temperature is greater than 37.5 degrees, we gently advise the patient to call his or her family doctor. If normal, we proceed with an on-site triage, asking the same questions as we already asked over the phone or the patients replied via email to our questionnaire. If the on-site triage is favorable, we proceed. The patient is then invited to wear foot covers. A gloved nurse takes the patient's jacket, cell phone, and puts all these personal belongings in a wardrobe and closes the door. Only the patient's jacket is in the wardrobe, which is locked with a key. We do not allow the patients to take their cell phones to the waiting room. If expecting an urgent call, the patient can divert the call to our office number. The patient is accompanied to the restroom, asked to wear a cap, and wash hands. After having put on a pair of disposable gloves, now our patient is ready to sign the triage and interact with the receptionist to settle the account. We encourage credit card payments or any other form of online payment before the patient enters the clinical area. For the time being, we do not accept cash payments. Future appointments are made by writing the time and date on a card or preferably via email or text message sent directly to the patient's cell phone. At this point, the patient is either escorted into the clinical area or to the waiting room, respecting social distancing. We can accommodate 3 patients in our first waiting room and 2 in the second one. Here are some further details. Everything the patient touches, like a pen, is disinfected. The nurse who touches the patient's jacket with gloved hands must sanitize her gloves before proceeding to the next steps. The patient is brought to a normal dental suite for preparation. 2 mouth rinses. A disposable, non-sterile light gown is worn, and the patient is asked to enter the surgical OR where all the monitors are connected to check the blood pressure, heartbeat, and oxygen saturation. We disinfect the perioral skin and apply surgical drapes. With the help of the non-sterile nurse, the final preparation of the surgical area is made. Nothing has changed so far but the placement of some extra PPE with minor changes with respect to the pre-COVID era. We then dismiss the patient. At the end of the session, the patient takes his or her jacket and the wardrobe is sanitized with Hygieneo. The patient throws away the cap, foot covers, and gloves outside the office. For the time being, we are receiving 40% fewer patients than pre-lockdown, so our staff have more time to pamper our patients and make them feel comfortable and protected.